Now it's being recorded. Good reminder there. And it will be uploaded to our website tomorrow. And as I said before, we're also live on Facebook. So now about our presenter. Our presenter is Jaimee Mace, a physical therapist from Reading who has been practicing since 1999. She is an expert in orthopedics, injury prevention, manual therapy, and wellness. Jaimee has given on-site presentations at golf courses to teach basic stretches and strengthening exercises to prevent common injuries. She's going to share that expertise with you all tonight, so you will have an injury-free season. Welcome, Jaimee.
Thank you. Thank you so much. As Ellen said, my name is Jaimee Mace. I've been a physical therapist for over 20 years. Currently, I'm the owner of FIT, which is a mobile physical therapy and wellness practice. And I will admit, I am not really much of a golfer myself, but I am married to an avid golfer. So after years of listening to him and his buddies talk about their aches and pains, I thought, there's some pretty easy things that they could do to prevent these injuries. And then, kind of talking to my husband about it, I realized that I could just put together a quick conversation and presentation for anybody out there that wants to golf. I know it's a great sport that you can play forever as long as you can keep yourself pain-free. And there's some easy things you can do to stay that way. So I have a presentation put together. And as Ellen said, I will happy to answer questions at the end, but I'm going to share my screen and then we'll get started. All right, so hopefully you guys can see this okay. So again, injury prevention on the golf course. When we talk about golf, there are really a lot of great benefits to the game of golf. When you look into it physically, it really can help with a whole range of things. It can help increase your muscle tone. It can help increase your core strength, which is really important. What I thought was interesting when I was doing research, they talked a lot about visual acuity. So something you don't think about, but when you're looking down the fairway or you're lining up a tee shot, that's going to help with your vision, keep your vision nice and strong. And it also helps with weight control, especially if you're carrying your clubs when you play instead of riding in a cart. Psychologically, what I thought was interesting, I kept finding that it was a good stress reliever. I'm assuming that's if you're good at the game of golf, because I'm terrible. And when I play, it's very frustrating. So I feel like it builds up my stress. But I know that being out on the course in nature can be very calming and can help with your stress. And it's a great place to build relationships and network for business. So I know a lot of people take, business clients out on the course to network, which is great. However, there are a few common injuries that we see. So back pain is the #1 injury that people report. Back pain accounts for about 54% of reported injuries from golf. Second up is shoulder or rotator cuff injuries. Then there's elbow tendonitis. So when they're talking about the golfer's elbow, that will be the inside of your elbow. So the outside of the elbow usually would come from tennis, and the inside of the elbow is the one that comes from golf. And knee pain is the 4th one. So why does this happen? So really a lot of it comes from overuse. So I just quoted a study that I found that said, 83% of people reported their golf injuries from an overuse kind of thing, meaning, you're doing the same kind of swing over and over again. So the same movements, the same irritation to your joints. Only about 17% of people said it was from a one-time event. So it's usually more of an overuse thing. Improper form can often lead to injuries as well. So if you're someone that has a lot of elbow issues with golfing, sometimes it's as simple as loosening up your grip. So if you're squeezing the club too tightly, that can be one of the reasons why you develop that elbow tendonitis. Warming up is really important, and that's something we're going to talk about more later. But of people that warm up, they report 50% less injuries. So taking, 10 minutes before a round of golf just to stretch and loosen up can be really beneficial. And then altered biomechanics. So as a physical therapist, that's the stuff I love to get into. So if your hamstrings, which are the muscle in the back of the thigh, if they're really strong and powerful, they overpower your glute muscles, which is kind of the muscles of your bum. And that can cause all sorts of problems. So the butt muscles should help extend and rotate the hip. And when the hamstrings overpower the glutes, then what ends up happening is you get that rotation from your back, and we can run into all sorts of problems with that. So I put this clip in here. Hopefully it will come up. When I was discussing this talk with my husband and I was talking about the glutes, he said I had to include this clip just because it was just something I thought was pretty interesting. So I'm going to play this for you.
Well, it's just my glutes are shutting off. They don't activate, and then once it doesn't lower back. So I tried to activate my glutes as best I could in between, but they never stayed activated. Different.
So like I was saying, how if your glutes aren't working correctly, then other parts of your body have to do their job. And that's when we run into trouble. So if it can happen to Tiger Woods, who has, his own personal trainer, physical therapist, whatever, if it can happen to you, then it can happen to anybody. So when we talk about kind of why this stuff happens to your back, I thought this was very interesting. One of the biggest or strongest predictors of low back pain is a golfer's BMI, which is their body mass index. So that's just a ratio of weight to height. So in general, this was really interesting. Shorter, heavier golfers are less likely to experience low back pain. The reason that is, if you get a tall, skinny golfer and they're, when they swing, there's a lot of torque in that movement. And if you don't have good strength and control, you can irritate your back. So I thought that was an interesting take home right there. So the main reasons why back injuries occur. Greatest contributing factors is that core weakness. So we'll talk a bit about how important it is to have the core nice and strong. The poor glute activation that I mentioned, so the muscles of your bum. Poor low back flexibility, so you have to have a lot of good rotation in your back. Decreased hamstring length, so again, that's that muscle behind the thigh. And this one was interesting too, the excessive side bending. So what that means, if you take, and I'll try to show you, if you take a really long backswing, then there's a pretty high velocity when you come down, and that ends up causing problems on the side that you're swinging. So if you're a right-handed golfer and you bring the club back down and rotate, you end up a lot of times having right-sided low back pain. So what can you do about that? So important to start with is strengthening your core. So if we look at our core, if we look at our stomach, there's a lot of different layers of muscles, and hopefully you can see my pointer here. So the outer layer here is your external obliques, your rectus abdominis, your internal obliques, and then your transverse abdominis. So when I ask people what their idea of strengthening your core is, a lot of times people will say sit-ups. And the muscle you're working when you do a sit-up is primarily this one right here, your rectus abdominis. Now, if you think about your golf swing, you're not trying to crunch down into your golf swing. So it's not that doing sit-ups isn't helpful, but it's really not the primary exercise you want to go towards. You want to be thinking more of rotational sit-ups, planks, and then the real key exercise to work to keep your back safe when you're golfing is this deep muscle here, your transverse abdominis. So where the rectus abdominis sits kind of this way, the obliques are on angles, the transverse abdominis wraps around. So that one is really important for keeping your back nice and stable and strong. So what happens with the transverse abdominis, when you activate it, it takes pressure that would normally go right to your spine and it distributes it through your abdominal cavity. So it takes that pressure off of the back. In people that have chronic low back pain, studies show that 80% of them have pretty poor strength in that transverse abdominis. So in your handouts, there's a picture of how to activate that, but I'm going to have you guys try it for me now. So if you take your hands and just kind of put it on your belly, you're going to find your belly button, come out about an inch and go down another inch. Okay. So if you rest here in this position with your hands just right on your belly, and then without holding your breath, I want you to try to pull your belly button kind of back and away from your hands. All right. So I want you to see if you can pull that belly away from your hands. Again, don't hold your breath, keep breathing. What's happening there is that transverse abdominis is contracting and pulling the stomach back. Okay, so like I said, it's on the handout. It's a simple way to start working on it. In the picture I show you, you're going to start to work on it laying down. It's the easiest way to do it because gravity will kind of pull that muscle down and help you contract it better. But once you get the hang of it, it's something you can do sitting, standing, picking up the laundry or the groceries, whenever. It's a really, can be tricky to learn at first, but once you get the hang of it, really easy exercise to do and really important for your back. Now, the next interesting thing is that when we talk about the core, Everyone always thinks of the front, and you actually have to consider the back as well. So it's now, instead of just calling it the core, now it's usually called, in the physical therapy world, we call it the lumbopelvic region. So lumbar spine, pelvis, core, all together is what's mostly important and what you want to focus on when we talk about the core. So when we're talking about that lumbopelvic region, we include the glutes back here. So when we talk about the glute muscles, there's actually 3 different parts of the glute. So this big, huge one is kind of what you think of when you think of your bum. That's your glute maximus. And then there's a glute medius and a glute minimus. So to contract that glute muscle, it's very easy to do just when you're sitting in your chair. I want you just sitting, try to squeeze your bum cheeks together, okay? You should feel like when you do it, you're lifting yourself up off your seat a little bit. So you'll lift up an inch or 2 and then relax it. This is a really easy one you can practice again anywhere. So keep in mind that you want to contract it slowly and then let it go slowly. So if you contract it and then just relax, you're missing out on half of the strengthening. So it's just a contraction of that glute muscle, squeeze the bum, and then slowly release it. And like I said, that glute muscle is really important for hip extension, like bringing the hip behind you and rotating, which is what happens in your golf swing. The picture on the other side here is your multifidus muscle. So these muscles right here, it's a tiny muscle that goes up our spine and spans a couple different vertebrae. So if you can see on this side, it starts out on a bony prominence out to the side and then comes into the middle a few vertebrae up. So it helps a lot with stability of the spine and rotation. Again, super important stuff for when you're golfing. So multifidus weakness has been correlated with increased risk of spinal stenosis. And if your doctor has ever told you you have a herniated disc or spondylolisthesis, anything like that, the stenosis, having strong lumbopelvic region muscles is crucial for when you're golfing. So the second runner-up as far as prominence of injury is the shoulder. Our shoulder joint is extremely complicated. So it moves forward, it moves backwards to the side, it rotates, it has a lot of movement. And if we develop any kind of muscle imbalance, then we can set ourselves up for impingement type injuries. So if you've heard of that, the rotator cuff injuries, tendonitis, those types of things. So there's the main muscles of the rotator cuff, there's 1, 2, this guy right here, 3, and 4. Important to have those all equally strong. And there's a lot of different bony prominence through here as well. What can happen with your swing mechanics if you're kind of crunched forward and swinging, that can cause a lot of irritation in the shoulder. And something you can work on every day is posture. So if you think of, or if you look at, this is the head of my humerus bone here. When I have bad posture, that comes forward in my joint and my head sticks forward, kind of like the guy on the side. When I'm in that type of position, the muscles in the front of my chest get really tight. So my pec muscles get really tight. And then the muscles around my shoulder blade in the back get stretched out and really weak. So there's that decreased shoulder blade stabilization. So when you're swinging, the humerus is kind of moving around in the joint ways it shouldn't and can press into those rotator cuff tendons. What can you do throughout the day? So sitting, when we're talking about posture, this guy in this picture, you kind of think of your back as a letter, right? So here it looks like a giant letter C. You want to be careful and stay away from that position whenever possible. Your goal is to have your ears, your shoulders, and hips in a straight line whenever possible. Naturally, we have a little bit of a curve out at the top of our back, a little bit of a curve in at the bottom. You may have seen people sitting with lumbar rolls or supports like that, but you really want to stay out of this positioning as much as possible. If you're on a computer a lot for work or at home, really being careful of your alignment. I tell people a quick way to check with your computer setup is if you stand up nice and tall and you put your elbows to your side and you have your elbows at a 90-degree angle. When you sit down at your workspace, this should all stay at the same height. It shouldn't move. So your shoulders shouldn't hike up when you sit down. Your elbows shouldn't bend up when you sit down. Everything should stay in that same position. And the monitor should be, the top of the monitor should be right about eye level. So you're not looking down. When we're on laptops, people run into a lot of problem with that. So elevating your laptop, adding an external keyboard so that you can type in the right position. Those things are hugely important for posture. And then just the phones. You know, it's not just the kids that you see slouching over their devices, it's grown-ups too. So if you take that cell phone and you just pick it up, it puts you in a much better posture. So when you're talking about posture, when you're lining up to take a shot, when you address the ball, you want to tip yourself forward so that your belt buckle, or where your belt buckle would be, is turned towards the ground so your low back stays nice and flat. You don't want it really arched like this guy here, or really extended. Sometimes what happens, if we have really tight hamstrings, again, which is that muscle kind of in the back of the thigh, that pulls at your pelvis and makes it really hard to get out of this position. So you might be trying really hard to straighten yourself up, but you can't because your hamstrings are too tight. So this is the position you want to aim for. You want to try to stay out of this position. So if the hamstrings are too tight, we end up kind of slouched this way. And if our hip flexors are too tight, we can end up being excessively curved in our low back. So those are two things you want to watch out for. You want your back to be nice and straight. And again, that belt buckle, or the area where your belt buckle is, should be kind of tipped down towards the ground. Coming into posture again, we said, you know, it's better a benefit if you can be carrying your bag with you, but the way you carry it is important as well. So when you're carrying your bag, it should be seated so that it's only at about a 20 to 25 degree angle. So not much of a tip to it. You know, I see a lot of people walk with it. It's on an angle here. You really want it down to this type of position. Use both straps at all times. You should set your bag up so that your longest, heaviest woods are closest to your body. The longer irons in the center of the bag. Your shorter clubs should go in the last section, farthest away from you. And then everything else you should distribute evenly throughout the pockets. So your tees, your balls, your sunscreen, try to spread them out through the rest of your bag. And then if you're going to use a push or a pull cart, you know, people will sometimes ask which way is the best way to do it. You really want to try to push it whenever you can. So golf, as we know, is very kind of one directional. We do the same movements a lot. So if you're dragging that cart behind you with just, you know, one side, it's that same kind of torquing motion. So try to push it in front of you when you can. Okay, now we're going to get into kind of the meat of the whole thing with our exercise bit. So stretching. We talked about some of the benefits of stretching, increases muscle and tissue length. It helps increase circulation as well, and it also helps release endorphins. So endorphins are those chemicals that make us feel better and help with pain relief, so really important. But there's two different types of stretching. So if I ask people, how do they stretch? How long do they hold it? Most people will say, well, I'll hold it for 30 seconds to a minute. That is what's considered a static stretch. And static stretching, we actually want to save for days when you're not golfing or for after your round of golf. And I'll explain why. So when you do a static stretch, if you can imagine this is your muscle, and then you're stretching it, when you hold it, it's going to stretch and elongate. Now, if you try to take that elongated muscle and then, you know, go out and try to play a round of golf, there's been studies that have shown that that muscle is not going to have as much power as it usually does for, you know, maybe a couple hours after you do those stretches. And that's just because it's in that longer position and it hasn't quite made the new connections yet. Dynamic stretching instead is more of we're going to go over this, you're going to do quicker movements. It's not bouncing, but it's doing a quick stretch for a second or two and repeating it more often instead of the traditional static stretch, which is the 30-second hold and you're repeating, you know, say 2 to 3 of them. The dynamic stretching, which is what you should do before a round of golf, should take you about 5 to 10 minutes, and you're doing about 10 to 20 reps of each exercise without bouncing, like I said. So these pictures will be in your handouts. So the first ones, the ones on the left are going to start with the static stretches. So you can try it along with me. So what you're going to do for the first one, this is going to be your static hamstring stretch. So if you sit yourself real close to the front of your seat, and then you're going to put one leg out. I don't think I can go back far enough for you to see me, but you're going to put one leg out in front of you with your heel on the ground. The important part here is that you sit up really tall and that you're going to bend forward from your hips, not rounding through your back. So it's almost like your chest is going to lead the way. Your knee stays straight. You get forward to a point where you feel a nice pull in the back of the thigh, and then you hold it. So this is that static stretch where you're going to hold it for about 30 seconds. When you're stretching, you shouldn't be bouncing and you shouldn't be going to discomfort. If you go to discomfort, your body's going to fight you and you're not going to get any stretching. So where you feel a nice gentle stretch, hold for that 30 seconds. And then when you come out of stretches, come out of them slowly. So sit back up slowly. You can switch to the other side. You're going to repeat each one 2 times. Okay. The second picture for the hamstrings is just another way to do it. The picture shows you using a chair, but you can use a stool. You can use a stair. It's just if you're up and moving around and you want to stretch your hamstrings, it's easier to do that than having to find a seat to sit down. Now, the last one is going to be that dynamic stretch. So it looks more like a walking. So you're going to take one leg at a time and just stretch this way, right? So it's that 10 to 20 repetitions on each side. And you can do it while you're walking forward. It doesn't have to stay in one place. But that's going to be that dynamic stretch that you want to do that just gets the muscles warmed up before you play a round of golf. The next one is going to be for your low back. So we talked about that flexibility in the low back being important also to help keep back pain away. So the first one, laying down on your back, knees are bent, feet are on the floor. You're just dropping your legs comfortably to one side. Shoulders stay down, but the hip and the bum can come up as you rotate. So again, to one side for 30 seconds. And then to the other side for 30. There's an option to do it seated, just hands across the chest, rotating side to side if you want to try to do these in the middle of your workday. And then the last one is going to be that dynamic one. So you can take that golf club with you, just kind of going side to side to get your trunk warmed up right before your round. This is going to get into the wrist. So this is going to talk about that elbow tendonitis that we talked about. So keeping the elbow tendonitis away by loosening up your grip on the club and keeping those muscles nice and flexible. So there's 2 different directions. The picture on your program that I gave you is going to be for your wrist flexors. So coming in this direction, but you can also work your wrist extensors stretching like the first picture. And then the last one for the dynamic, taking the club side to side and just rotating it. This one here at the bottom is for those tight pec muscles. So super important when we talk about that posture again, keeping that chest nice and open so that that humerus can sit in the right spot in the joint. So you come to a door frame. In the picture, the girls, elbows are kind of right by the shoulders. You can practice and see what feels best for you. So the arms can slide up the door frame a little bit. They can come lower, whatever feels comfortable. You start in the door frame and then take a step forward. Lean your whole body forward. So you're not tipping your chest forward. Your whole body's going to lean forward until you feel that stretch right in the front of the chest here. So either in the door frame or in the corner, like the woman in the second picture. That's again, your static stretches. Your dynamic one, you're taking the club just over the head and then back, right? 10 to 20 times to loosen that up. So those are a couple really key important stretches you can do on a day when you're not playing or before a round of golf. And then the last ones are going to be going over some strengthening exercises. So we've hit on a couple of these already. That first one is that transverse abdominis exercise. So like we talked about, we tried it sitting up, but at home, start with laying down. You're on your back, knees are bent up, feet are flat, hands are on your belly. And then you're just trying to make sure that when you draw that belly button down towards your spine, you want your belly and your hands to drop down. You don't want them to poof up. So if they're poofing up, you're doing it wrong. So you really want to make sure it's a gentle contraction and the hands are dropping, the belly button's dropping down towards the floor, but you cannot hold your breath. So if you're holding your breath, you're actually engaging the wrong muscles. So you want to make sure you're breathing the whole time. Start with shallow breath. So it's hard to take a deep breath at first. If you just take light, shallow breaths, that's easier. But as you keep working on it, you'll get better. The second picture over here is another version of that glute squeeze. So we had practiced that sitting. This is just a laying down version of it. Again, just squeezing that butt muscle together and then slowly releasing it. This third one here is for the shoulders again. So we stretch the chest, doing our pec muscles. Now the second picture is this one here is for strengthening the muscles of the shoulder blades. So important when you do this, you're trying to pull your shoulder blades together, but together and down. So a lot of people, when I ask them to pull their shoulder blades together, they pull them together and pull them up. And that can actually irritate your neck and cause some other issues. So you want to make sure you're pulling the shoulder blades together and down. And you want to pay attention to where your ribs are. You don't want it to be that when you pull your shoulders together, you're flaring up your ribs. You want your ribs to stay down as you pull the shoulder blades together. Okay, so that'll kick in some of the muscles around the shoulder blade to get those shoulder blades nice and stable. The last picture is going to be for that multifidus muscle along the spine that we talked about. So if you're able to, you're laying on the ground, a couple pillows for comfort at your hips so your back isn't arching too much, and then take a rolled up towel at your forehead so you can still breathe. And then you can add in that core contraction that you're doing here with the transverse abdominis muscle. And then you're alternating arm and leg lifts. So it's not a really high lift. You're trying to just lift a tiny bit up off the ground, an inch or two, and then back down. So you would do right arm, left leg, and then switch to the other side. These strengthening exercises will be more about repetitions. The general standard is doing, 3 sets of 10 a couple times a week. So those are the core basic exercises that you guys can work on. Hopefully you all have looked at your pictures. When you go over those, my phone number and email are on the bottom. So I'm going to stop sharing my screen. So if you look at them and you have any questions, you could always reach out to me, give me a call. I'm happy to answer some questions now. I'll do my best to answer them if they're specific towards you. Sometimes it's hard for me to answer them if I don't have the chance to put my hands on you and kind of assess your strength, but I'm happy to try to answer questions. And thank you everyone for coming. I appreciate it. So if anybody has any questions, you can feel free to put them in the chat, or I think Ellen was going to let you, maybe if you could raise your hand. That's always the fun time. Or like I said, if you come up with something later, you can always email me a question or give me a call.
If anybody has a question that's too long to type, you can also, I think you can raise your hand, right? And then I can unmute you. Oh.
That's right, they can raise their hand too. I know I throw a lot of information out there, so.
Okay, some are coming in, you see them?
Yes. So any recommendations for knee pain? Yes, I would say the main one that I hit for this is the hamstrings. Right, so the hamstring stretch is super important. When it comes to the knee, if you can keep your glutes strong and your back flexible, then you'll get your rotation in the right spot and it won't come from the knee joint, if you can imagine that. So if you're, when we're not strong in our glutes or flexible in our low back, those movements have to happen somewhere. And sometimes that happens at the knee joint. So doing that combination of those exercises should help the knee as well. And then let me see, how do you do the transverse abdominal exercise? Standing up or sitting down? Yep. So when we went over it, easiest to learn laying down, like you have in the picture, just because gravity will help that muscle contraction happen. But then when you're sitting or standing, if I'm here and I just work on that, that's really all it is, kind of like sucking in your gut, right? If you're trying to put on a tight pair of pants, that's really what it's like. However, it's gentle, it's a small movement, and you don't hold your breath. So you can do it sitting, standing, anywhere, anytime. It's just easiest at first to do it laying down. And remember, really be careful that when you pull in, you're not pouching out. You got to make sure it's coming in when you do that exercise. And then yoga poses. I don't know that there's certain poses per se. I actually think overall yoga is really great if you're doing it the right way, because that does a lot of core strengthening. You're going to hit most poses, you're going to hit either a ton of core strength or a ton of balance. So I don't know if that's per se that I have any ones in particular. I know planking is not really a yoga pose, but that's a great one to do as well. Down dog is going to work on your shoulder flexibility and your core strength as well. So yoga in general, as long as, again, you're doing it the right way and you have an instructor that can help you. I know that there's people who, hurt their back sometimes doing yoga because they just don't activate the right muscles or set themselves up right. So as long as you have a good instructor, I think for the most part, most yoga poses are really great and can be really helpful.
We have a question in the Q&A too. Is stretching different for women?
No, no, not that I know of. I haven't, I mean, no, it's the same basic recommendations. They do sometimes say with women, not for stretching, but for strengthening, with osteoporosis, that strengthening wise, you really want to even get into more strengthening with heavier weights too. So a lot of the exercises I show are basic core strengthening stuff, but overall in general, women versus men, they do recommend that women do some heavier weight training as we get older for that feedback into our bones to help with osteoporosis. That's a good one. My husband wants to know the proper technique for throwing a glove. I think as long as you curse when you're throwing it, you're good. That's perfect. All right, we have any other hands raised? Those were good questions though. I know I go through a lot and I tend to talk fast, so hard to catch everything I say.
Oh, also, if you didn't get the handout and you would like it, I'm going to put the email address. You're going to have to email. Well, yeah, you can email our assistant director, Charlotte. She has them and can send it to you. I'll put her email in the chat.
Perfect. And then I do see just one other one. This is before getting out of bed, I straighten my leg to stretch my hamstring. So I'm assuming that means like when you're on your back. So it is, if you're laying your back in bed and then you put the leg up to stretch your hamstrings, that's great. Yep, it's a perfect way to do it as well. Anytime you can get a stretch in there. Like, can the warm-up dynamics be done 30 to 60 before the round or just before? Oh, it's fine to be 30 to 60 minutes before. That's fine. You just want to make sure you're not going out to your round of golf totally cold. If you'd been sitting in a chair or working all day and then you go out and hit the course, you want to make sure you're doing some kind of warm up. So it's okay if it's, 30 to 60 minutes before you play. It doesn't have to be right before, but you don't want to do it in the morning and then work all day and then go to the course later. So probably about an hour before is the most I would do it. I appreciate the questions.
Anything else for Jaimee today?
Yep.
Okay, I think we're all satisfied with our new knowledge.
My favorite one is about how to throw the club. Well, thank you again, everyone.
Thank you, Jaimee, and thank you everyone for coming.
All right, take care.
Bye-bye.